Let me begin with a question I often ask my patients. What number makes you feel safe? For many people, it's their blood pressure, 120/80. They see it on a report, nod with relief, and assume their heart is protected. But here is a clinical truth that unsettles even highly educated patients. You can have perfectly normal blood pressure and still be minutes away from a heart attack. I've seen it happen. A 48-year-old corporate lawyer exercised 3 times a week, never missed his annual checkups, blood pressure consistently normal. One morning, while climbing a short flight of stairs, he felt something unusual, not dramatic pain, just pressure, a strange heaviness. He assumed it was fatigue. It was not. Within an hour, he was in the emergency room experiencing a major cardiac event. So what went wrong? As legendary physician Dr. William Osler once said, "The good physician treats the disease. The great physician treats the patient who has the disease." Numbers alone do not tell the full story, because the heart does not fail based on a single measurement. It fails based on processes, many of them silent. Here is where the misunderstanding begins. Blood pressure measures the force of blood pushing against your artery walls. It does not reveal what is happening inside those walls. You can have smooth pressure while dangerous plaque quietly builds like rust inside a pipe. No warning, no noise, no symptoms. In cardiology, we sometimes call this the silent progression phase. The body adapts so well that it can hide serious arterial narrowing for years, until one unstable moment changes everything. And what makes this particularly frightening is that many heart attacks occur in people who never considered themselves at risk. Which raises an uncomfortable question. If blood pressure isn't the full picture, what is? To answer that, we need to look deeper, beyond the numbers, into the biology of how heart attacks actually begin. Because what most people imagine is not what usually happens. Blood pressure tells us how hard blood is pushing. It does not tell us how healthy the artery is. Think of an artery like a water pipe. The pressure can look perfectly normal, while the inside wall is slowly narrowing. This narrowing usually comes from plaque, a mix of cholesterol, calcium, inflammatory cells, and cellular debris. And here is the dangerous part. Plaque builds silently. No pain, no warning, no early alarm. I often explain it to patients this way. Heart attacks are rarely sudden events. They are sudden discoveries of a process that has been developing for years. A famous cardiology principle states, the artery doesn't have to be fully blocked to become deadly. In fact, many heart attacks occur when a moderate plaque suddenly ruptures. Imagine a small blister inside the artery wall. If that blister tears, the body reacts instantly by forming a clot. And that clot can block blood flow. Within minutes, pressure was normal, but the biology was not. This is why relying on a single good number can create a false sense of security. Because the real danger is not always force, sometimes it's fragility. And what makes plaque unstable in the first place might surprise you. It's not always what doctors used to blame. One of the most unsettling conversations I have with patients starts like this. But doctor, I do everything right. They exercise, they aren't overweight, their blood pressure is normal. Yet heart attacks still happen. Why? Because heart disease is rarely caused by one obvious problem. It is usually the result of multiple silent factors working together. Let me give you a real clinical example. A 52-year-old runner completed half marathons, avoided fast food, never smoked. One evening after a jog, he felt nausea and unusual fatigue, no crushing chest pain, just a sense that something wasn't right. At the hospital, tests confirmed it, a heart attack. The cause, inflamed, unstable plaque. Here is something modern cardiology emphasizes. Inflammation can be more dangerous than cholesterol alone. When arteries become chronically inflamed, plaque develops a thin outer cap. If that cap tears, the body treats it like an injury and forms a clot. And clots don't gradually slow blood flow, they stop it. As renowned heart surgeon Dr. Denton Cooley once warned, the heart is the most vital organ, yet often the most neglected until it fails. Another hidden trigger? Stress, sudden emotional shock, intense anger, or extreme physical strain can spike adrenaline and blood pressure within seconds, enough to rupture vulnerable plaque. This is why some cardiac events occur during arguments, heavy exertion, even moments of panic. So the takeaway is both simple and uncomfortable. Looking healthy is not the same as being protected, which leads to an important question every intelligent patient eventually asks. If symptoms aren't reliable, how do heart attacks actually announce themselves? Because many don't look like the dramatic scenes you see in movies. Let's go there next. When people imagine a heart attack, they picture sudden collapse and severe chest pain. But in clinical reality, it is often far quieter. Many patients don't feel pain. They feel something unusual, pressure instead of stabbing discomfort, unexplained fatigue, shortness of breath, cold sweats, nausea. Some describe it as a weight sitting on my chest. Others simply say, I felt a strange sense of doom. Never ignore that feeling. As emergency physicians often warn, the body whispers before it screams. Here is something even more concerning. Nearly 1 in 5 heart attacks are silent, meaning the damage occurs without the person fully recognizing what is happening. This is especially common in people who believe they are low risk because their numbers look good. Women, in particular, frequently experience atypical symptoms: jaw discomfort, back pain, dizziness, or overwhelming exhaustion. Not dramatic, but dangerous. I once treated a patient who thought she had severe acid reflux. It was not reflux. It was a cardiac event. Remember this rule I tell every patient new. Unexplained discomfort above the waist should never be ignored, because when it comes to the heart, time is muscle. The longer blood flow is blocked, the more permanent damage occurs. But this raises a critical question. If blood pressure alone cannot predict risk, what should we actually be monitoring? The answer is where modern cardiology has made its biggest advances. If there is one mistake intelligent people make, it is assuming that a normal checkup means a safe heart. But medicine today allows us to see far beyond basic numbers, because what we truly want to detect is hidden arterial disease before it announces itself. One test I often recommend for appropriate patients is the coronary artery calcium scan, commonly called the CAC scan. It takes only minutes, yet it can reveal calcified plaque inside your arteries long before symptoms appear. Think of it as a flashlight inside the pipes. A score of 0 is deeply reassuring, but higher scores tell us something critical. Plaque has already begun forming. As preventive cardiologist Dr. Arthur Agatston said, the goal is not just to treat heart attacks, it is to prevent the first one. Another powerful tool is the CT coronary angiogram. Unlike routine blood work, this scan can detect softer, unstable plaques, the kind more likely to rupture. Because remember, many dangerous plaques do not severely narrow the artery. They simply break without warning. And then there is something many people underestimate: advanced blood markers. Tests such as high-sensitivity C-reactive protein, HSCRP, help physicians evaluate inflammation, one of the strongest predictors of future cardiac risk. Here is the reality I share with patients: prevention is always quieter and far less painful than emergency treatment. Yet even the best technology is only part of protection, because daily habits still determine whether those plaques stabilize or become fragile. Which brings us to the question every patient eventually asks me: what can I do, starting now, to lower my risk? The answer is both simpler and more powerful than most expect. Let's finish with that. After decades in medicine, I can tell you this with certainty: most heart attacks are not random. They are often the final chapter of a story the body has been writing for years. The good news: you have far more control than you think. Let's focus on what cardiology consistently shows protects the heart. Control inflammation, prioritize whole foods, reduce ultra-processed sugars, and avoid chronic metabolic strain. What you eat directly influences the stability of your arteries. As Hippocrates wisely said, let food be thy medicine. Move your body. You do not need extreme workouts. Even brisk walking strengthens blood vessels, improves circulation, and helps stabilize plaque. Remember, the heart is a muscle, and muscles thrive on use. Protect your sleep. Poor sleep quietly raises blood pressure, increases stress hormones, and promotes inflammation, a dangerous combination over time. Quality sleep is not a luxury. It is biological maintenance. Manage stress before it manages you. Sudden emotional spikes can trigger real physiological events. Learning to regulate stress is not just psychological. It is cardiac protection. Know your real numbers go beyond basic blood pressure. Discuss cholesterol patterns, inflammation markers, and when appropriate, advanced imaging with your physician. Because the most dangerous sentence in cardiology is this: I thought I was fine. Let me leave you with a perspective I share with every patient. Heart attacks rarely begin on the day they happen. They begin years earlier, silently. But prevention works the same way. Small, intelligent decisions repeated daily build arteries that are stronger, calmer, and far more resilient. As famed physician Dr. Paul Dudley White, one of the founders of modern cardiology, once said, a vigorous 5-mile walk will do more good for an unhappy but otherwise healthy adult than all the medicine and psychology in the world. So do not wait for symptoms to respect your heart. Act while you are still feeling strong. Because the goal is never just to live longer, it is to ensure your heart carries you there safely.